Hi, my name is Dr. Jeff Hayes. Today I'm going to be talking about what I call the best exercise known to man. This, of course, I'm talking about is lunges. If you've taken one of my exercise classes before, you've probably heard me say this before. The reason why I like lunges so much is primarily, first of all, it works all the muscles in your legs, quadriceps, hamstrings, inner thighs, outer thighs, and especially the glutes, which we'll talk about later. Extremely important muscle to work for stabilization of your pelvis and your lower back, as well as to assist in prevention of injuries to these areas, as well as your knees. The second reason I like lunges is because it doesn't require a lot of weight. You can do it pretty much anywhere. Because one leg is doing most of the work when you do the exercise, then again you don't require a lot of weight, so it's simple to do pretty much anywhere. Third reason I like it is because it requires balance, which means typically it's going to help with overall with your core strength and balance, which is an extremely important aspect of fitness as well. There are lots of different types of lunges. What I like the best is what I call the out and back lunge. The out and back lunge basically works as follows. What you're going to do is you're going to take a fairly large step, drop down, press back to where you were. The reason why the exercise, this type of lunge is so effective is because it takes a lot of energy to get me back from here to where I started. Okay. Versus other types of lunges such as stationary lunge where you're just going up and down. Or lots of people do walking lunges. You'll see people walking through the gym, coming up and then continuing through. Again, more energy pushing me back to where I was than just to lift me up. So for that reason, we're always looking for the biggest bang for our buck we can with these different types of exercises. So proper form on the out and back lunge. First of all, what I want to do is I want to take a fairly large step. It's very important to keep the stress off your knee, that your knee doesn't come forward or pass up your ankle. Once I start to get into this range, that's going to put stress on my knee. So once I take that big step, which I need in order to prevent that from happening, then my momentum goes down, not forward. That way, once again, I keep that relationship between the knee and the ankle the same, vertical alignment. I come down, I bend no more than 90 degrees, and I push from my heel back to where I was. If I can get that weight on that front heel, then what that's going to do is it's going to maximize the amount that my glutes are working. And that's an extremely important part of the exercise, again, is to get these glutes to do as much of the work as we can, so then we stabilize the pelvis, we stabilize the lower back, etc. So, second thing I want to focus on is making sure the shoulders stay aligned with the hips. So when I step out, I'm not leaning forward, I'm not leaning back, I'm keeping everything in proper alignment. Once again, the weight's on the front heel, I drop down no more than 90. From the front heel, push back to where I was. Now sometimes balance can be a challenge, so when you're first getting used to the exercise, what I recommend is you find something that you can hold on to for balance so that you can make sure that all these other components are done properly. You don't have to think about whether or not you're going to fall over while you're doing the exercise. So I'll just take my hand and I'll run it along the wall for balance as I do the exercise. Once again, pushing back from that heel. Once again, keeping the shoulders aligned with the hips. Now, one of the other things that I see people do, particularly to maintain their balance, is they try to keep the back heel on the floor, and you've got to make sure you raise that back heel. So when I step out, my heel's up here. Sometimes what I'll see is people will try to keep that heel down because they're afraid of losing their balance. But when they do that, it just rotates the hips that direction and actually can make the balance more challenging, as well as take away the proper stresses of the exercise where they should be. So you want to make sure that your hips are nice and square and that you're raising that back heel up nice and high so that you can get the proper position for the rest of your body. So to reiterate, the important parts of the exercise to make sure that you focus on. Number one is large step, so that once again the heel or the knee does not pass up the ankle. Number 2, no more than 90 degrees bending the knee. Number 3, weight is on the front heel, and I push back from that front heel. Number 4, shoulders stay aligned with the hips. Number 5, raise that back heel nice and high. And again, to accomplish all these things, it's practice. If you have issues with the balance, you do the exercise somewhere where you can stabilize yourself, wall, etc., while you're going through a learning process of making sure that all these other components of the exercise are done properly. Now, one of the things I recommend that you do before you do your lunges is stretch out your hip flexors. Your hip flexors do this. They tend to be tight because we sit too much. And it's important for those to be loose, because when I'm stepping out, I'm asking this hip to be nice and loose. I need the flexibility here to do this exercise properly. If this hip is tight, this is where I'm going to be. So I've got to make sure that these are nice and loose before I do the exercise. So the hip flexor stretch we do, usually I'll take a mat and pull it up a few times to use for padding for my knee. I'm going to throw it here on the floor. I'm putting my knee on top. I'll put my other leg out in front, so I'm kind of in that lunge position already. Make sure my shoulders stay aligned with my hips, and then I'm going to push my shoulders and my hips together forward until I feel the stretch in front of that hip here. If I want to increase the stretch, I can tighten or contract these gluteal muscles. That'll make me feel more stretch here. Or I can take the same arm overhead. These are ways of just trying to open up all this hip area on this side. So once again, I can do a better job of maintaining proper position when I'm doing the lunge. As far as repetitions, sets, etc., usually I'll tell my patients that we should do a minimum of 2 sets of these. 1 set, you're alternating sides, so I'm going left leg and right leg. Rest, maybe I'm doing 10 per side. Rest, after the rest, we do a second set where we do consecutive repetitions on the same side. So now maybe I'll do 10 on the left and then 10 on the right. First set is challenging my balance a little bit more because I'm constantly shifting from left to right. Second set is more fatigue because I do 10 consecutive on the same side, creating more fatigue in that side of in those muscles. Weights, you want to increase their weights. You can hold dumbbells in your hands through the exercise. You can put a bar on your shoulders. All these are things that you can do as you start to develop more strength and you need more resistance without having to do more and more repetitions. As far as how often do these exercises, if you're not using weights, if you're working at maybe 70% of your capacity, you can do them daily. If you're pushing yourself pretty hard like any other weight training exercise, you're going to want to get that recovery day in between. Once again, lunge is my favorite exercise, by far in my opinion, the best thing you can do for overall fitness of lower extremities and prevention of hip, knee, back injuries. Good luck with those.